Nausea and vomiting in pregnancy, or what may be known as morning sickness, can be one of the most disruptive and formidable symptoms throughout the entire pregnancy. And it can be very difficult to see the newly expecting moms go through this. As partners, we want to do everything we can to help. And so in this video, we've packed in all you need to know about nausea and vomiting in early pregnancy and some treatment options. Welcome to Dude Expecting. We look to give all partners and family members the tools they need to support their loved one who is pregnant. As always, at the New School OBGYN, it matters where you get your information. And so with that being said, I'm Eric Schmidt. I'm a board-certified OBGYN. Let's give you the tools you need to combat nausea and vomiting in early pregnancy. Nausea and vomiting in early pregnancy shouldn't just be minimized to morning sickness. I think it's a terrible term because it can be later in the day, it can be throughout the day, and the significant impacts that nausea can have in a pregnancy can lead to some impactful things in someone's relationships, in someone's job, in someone's ability to exercise, in someone's ability to just go through the day. It's also one of the leading causes of hospitalization in an early pregnancy. Let's go over some common questions that I get in my clinic. Should someone be nervous if they have nausea and vomiting in pregnancy? Generally, the answer would be no. Nausea and vomiting can be very common. Potentially, nausea can be up to 50 to 80% of all pregnancies, and someone having emesis or vomiting in early pregnancy can be around 50%, so it's very common. However, later on, we'll give you some things to look out for worsening nausea and vomiting that can potentially lead to something called hyperemesis gravidarum, something that is of concern. Another kind of follow-up question to that is, should I be nervous if I don't have nausea and vomiting in their early pregnancy? And I would say as long as everything else checks out okay, do not be nervous at all. Take that as a plus, and you do not need to have nausea for a pregnancy to be normal. Here's a quick little fact about nausea. Actually, female fetuses in some studies showed to cause a little more nausea, a little worse nausea. What causes nausea in pregnancy is another question, and well, it's really not that well understood. There can be a few different things, and one is the HCG and the fluctuating hormones that are happening. If we remember HCG from the earlier episodes, HCG is secreted by the growing pregnancy. The levels peak actually in the first trimester and then start to go down and plateau after that. And so it thought that this peak of HCG might be related to the symptoms of the nausea and vomiting in early pregnancy. And we do see moms that have more placenta, more HCG, such as twin pregnancy, maybe even triplet pregnancies, have definitely a higher risk of nausea in that pregnancy. Another thought is that an evolutionary mechanism that maybe back in the day, these food aversions would help protect a mom/baby from these potentially dangerous foods or items. It definitely doesn't hold true with all food aversions. And also there's thought that maybe some specific persons might have a predisposition to developing worse nausea and vomiting, whether that's somebody with migraine type headaches or a psychological predisposition. Let's go back to the question of, should I be concerned about my nausea and vomiting? And generally we said the answer is no, but there is this specific situation, about 3% of pregnancies, where you develop what's called hyperemesis gravidarum, or what it is that nausea and vomiting is so bad that it has not allowed someone to have adequate intake of food and drink, and so they're malnourished, potentially having weight loss. That actually is one of the criteria, is that someone has at least a 5% weight loss, and they might have other signs such as significant dehydration or electrolyte abnormalities. And so if your nausea and vomiting is so bad, you're throwing up every day, you can't eat any food, you definitely want to get a hold of your provider. If you haven't seen a provider, you can contact them sooner. Or if it gets so bad, it might need emergency room attention or possible admission to the hospital for correction of these abnormalities. Before we get into a lot of the different ways we can make nausea better, let's answer the question, is it going to be dangerous to the pregnancy in the early developing pregnancy, or does someone have to be worried if they're losing a few pounds? And generally the answer is no. The pregnancy in this stage doesn't need a lot of additional calories and can take from mom what they need. And so I often offer a lot of reassurance to patients that in the first trimester, losing a little bit of weight usually is okay. Just talk to your provider about it. As we've stated before, a lot of the best medicine is prevention. And so preventing nausea and vomiting in pregnancy, there can be a couple of things that we can do to help make it better. One thing that I would do is, as we keep preaching, take your prenatal vitamins actually before you get pregnant. And so having that good reserve of these different vitamins and minerals and nutrients might actually play a role in hopefully making someone's nausea not as severe. Also, there's a lot of dietary changes that someone can do if they're experiencing that nausea. This might be things such as eating smaller meals, so not eating the big 3 meals in a day, but maybe throughout the day 6 or 8 times just have a light little snack, let that digest and work its way through. Just drink a little bit of water. You really don't want to drink a lot of cold water. That might provoke the nausea. Certain foods such as spicy foods or fried foods might provoke the nausea. And so you kind of want to stay to a bland diet. So this might just be things like saltine crackers, graham crackers, little protein bars that you have with you on your person, and then potentially snack on it throughout the day. If someone's worried about their nutrient intake, you can try, certain protein shakes or Ensure to try and get in that more nutrient dense calories. One thing you also want to be careful of is lying down after she eats a meal, because the hormones of the pregnancy can cause the foods, the sphincter at the top of the stomach, to be a little more lax, allowing that acid in that food to get into the esophagus, which can be irritating and also provoke that not only the reflux, but also the nausea. Often what we're recommending too is just ginger supplements. Ginger can be very relaxing to the stomach. And so whether that's in the form of capsules, candies, tea is a very common one that doesn't have a lot of calories, but ginger ale, just got to be careful because it has more sugar in it. And so all those can be good options to help someone's nausea. So sour candies are actually a good option too, because that citric acid in there also helps to calm the stomach and the nausea. I learned this when I was on a cruise back in the day, but if you actually, the P6 point on the wrist, is an acupuncture point that if you have one of those wristbands, it could help somebody, but that's an acupuncture point where a little pressure there could help to relieve some nausea. Okay, so we just went through a lot of the lifestyle changes, a lot of the preventative, a lot of the supplement type medications that can help reduce the nausea. Let's go into some of the more medication type options, because early treatment of the nausea can hopefully prevent it from developing into that more severe case of the hyperemesis like we talked about before. And before I get into this, I actually want to emphasize too the option for treatment of the reflux or the GERD, because that acidity getting into the lower esophagus repeatedly can be actually damaging to the lower esophagus, cause more symptoms. And so treatment of the acidity of the stomach with reflux medications, whether this is like Tums or maybe better Pepcid, might actually be a good option for somebody if they're experiencing a lot of the reflux that comes with this. Okay, let's get into the medications for the nausea. The first line is vitamin B6, 25-50 milligrams daily, and medicine called doxalamine, or over-the-counter brand name Unisom. You can get both of these medications online or over the counter and start taking these as long as you don't have any contraindications. Or an alternative to the doxalamine would be Benadryl. Now, warning with these two medications, they might make you drowsy. And so often I'm recommending, if a patient needs to be alert during the day, is maybe taking these more at night, and might help with that early morning nausea. All those were options that you could potentially start taking on your own as they're over the counter. But if it's getting that bad, again, my recommendation is to talk to your provider, and they might give you medications such as Reglan or Compazine, or a potential medication called Zofran. Reglan, Compazine, very safe to take in pregnancy and can be taken up to 3 times a day. Zofran now has had some potential studies that showed maybe there could be an increased risk of what we call a cleft lip. They did find this association with this medicine. However, it only increased the risk of having one of these cleft lips in about 2.6, 2.5 out of 10,000 pregnancies. That's pretty darn rare. And so sometimes if someone is less than 10 weeks pregnant, we try to limit the Zofran use or the endosterone. But if the nausea is so bad where someone can't take in proper nutrition, you may need to start it before that 10 weeks. That's an option and a discussion you're going to need to have with your provider. But after 10 weeks, that risk really isn't there anymore. You shouldn't have any reservations about taking the Zofran if you're having the more severe nausea, because that's really the best medication to take. However, side effect it can have is constipation. not only can you get constipated from early pregnancy, but you're not eating and drinking normally. And now you're taking a medicine that's going to make you constipated. So it can be pretty significant. Best you can try and take a supplement like a stool softener, Miralax, or a fiber supplement if you're able to tolerate it, and adequate hydration with electrolytes. Now, hopefully you're starting to feel better with these medications, but there are rare situations where it's still not doing enough. And so there are other options like IV hydration, which can be done hopefully in the clinic, or there's freestanding IV hydration centers that a pregnant person could go to take in some fluids and nutrients and try to avoid hospitalization down the road. There also is a little subcutaneous pump of either Reglan or Zofran that someone can get that can continuously pump in the antiemetics or anti-nausea medicines, and hopefully, again, try to avoid hospitalization if possible. But if nothing's making it better, still not able to eat or drink anything, losing weight, having electrolyte abnormalities, potential hospitalization is needed in severe refractory cases. There are a couple points I want to make, because there have been some times where a patient's been suffering through nausea and vomiting, and I see them potentially for the first time when they're 10 weeks pregnant, and they've been suffering through for 3 weeks. And I say, well, why didn't you contact me sooner? So don't be afraid to contact your provider. They can potentially give you some options to hopefully make your nausea and vomiting more tolerable, as it can be severely debilitating for that early pregnancy. And here's a couple warning signs. If someone's having severe pain, any fevers, enlarged thyroid gland, which is here in the neck, and nausea that's really starting after the 9 weeks, meaning you didn't have it before, and now all of a sudden you have really bad nausea after 9 weeks, could be a sign of a different condition going on. And in those cases, you do want to contact your provider sooner. All right, everyone, we just went through some of the common questions someone has about nausea and vomiting, and hopefully us partners can do a great job in hopefully managing this time in the pregnancy, because it can be one of the times where we can potentially help the most and actually doing something to make a difference in her day and hopefully make her feel better. I hope you all have a good day. Like and subscribe if you feel like this video helped you out. It does help us out a lot to see that you do. So have a good day, everybody. We'll talk to you later. It's really warm.